The question is that the sitting be now adjourned. Mr. Paul Maynard.
Thank you, Mr. Streeter. Thank you for calling me to speak in this important debate. It's important, I think, because of the very, very, very large number of children in this country who actually require speech therapy to make the most of their lives. I'm delighted the Minister is able to join us today. I apologise for dragging her away from her important work actually putting together this green paper that we're also anticipating. I pay tribute to her personal interest that she has shown, not just since she got her job in government, but before, when she was in opposition. I'm not going to start by reciting the usual litany of depressing statistics that are associated with speech and language therapy as my opening gambit. That might be a little too predictable. But I would like to pay tribute to the work of some of the charities involved and also to pay tribute to the previous government, because what we have got today is the end result of a process. It started with a charity called ICANN and the campaign they ran called Make Chatter Matter. They spent 3 years building up awareness amongst politicians such as ourselves about the importance of speech and language communications. It led to the Burko Review, the Better Communication Action Plan that the last government brought forward, the appointment of Jean Gross as a communications champion, and the designation of 2011 as the Year of Speech, Language and Communication. So we are part of the way along a very important journey, a journey initiated by the last government, but taken up by the current government and brought forward. And that's why I think it's really important to also pay tribute to the fact that we now have a green paper coming forward. Amidst all the organisational changes that we are planning in the public services, I am delighted that the government has found space in its schedule for a green paper on the very important issue of special educational needs. It's a welcome opportunity not just to entrench greater choice amongst parents, earlier identification of the needs of those with speech and language difficulties, more tailored support, improved transition services that I believe are so important. But there is clearly work still to do. There's an organisation in the North West called the speechbubble.co.uk. Why they have to add .co.uk to everything these days, I do not know. But anyway, the speech bubble works in my constituency and many others in the North West, encouraging better quality speech and language provision. And in their survey of SEN coordinators, over half had not even heard of the Burko report, were not even aware of this process that was ongoing. So forgive me if I now embark on a bit of a shopping list of issues that I think still need to be considered within the Green Paper. And given the time and the number I now want to speak, you have to forgive me if it turns more into an episode of Supermarket Sweep than a shopping list. But I will do my best not to lose coherence. I think it is, though, crucially important, if nothing else, that I pay tribute to my own speech therapist today, Mrs. Williams, who saw me for 4 years between the ages of 5 and 9 to help me learn to communicate better. It was only when I was preparing for this debate that I actually began to think about what she was teaching me, because I never really thought about it at the time. She wasn't teaching me just to make a noise. She wasn't teaching me how to speak. She was actually teaching me how to communicate, how to actually get my message across. There's often a misconception somewhere that speech and language therapy is about putting stuff into people's minds that they can then say something. It actually isn't about that. There was plenty going on in my mind, actually far too much going on in my mind, and my mouth couldn't keep up with expressing it all. So what she taught me to do was slow down, not to panic, not to stammer, not to trip over myself, but just to slow down. And whilst that's not always ideal within a parliamentary setting when you have a 6-minute speech limit, it's still a useful lesson today, that there is no need to rush. That just because you have things to say, you don't need to get them all out in 30 seconds. So I pay tribute to her and her contribution. I will certainly, yes.
Can I thank the honourable member for giving way and congratulate him on securing this debate. And can I apologise, I will have to leave before the end, I have a meeting later on. But he quite rightly paid tribute to the work of his speech and language therapist. And would he agree with me that it's very important that the government at all levels and its development on its policy there works fully with the Royal College of Speech and Language Therapy in order to maximise the potential benefit that it can get from it?
Mr. Maynard.
I thank the Honourable Gentleman for that intervention, and I agree entirely. Our speech and language therapists are a much underused resource. And as time moves on, they're going to be in much, much more demand. There's a report shortly coming from the International Longevity Centre, which is going to tell us all about how, with the growing incidence of Alzheimer's and the difficulty of adults facing communication problems, the pressure on speech and language therapists is going to increase far, far more. I'm happy to give way again.
I thank the honourable member for giving way, and again, like the previous speaker, I congratulate the honourable member in obtaining this debate. One of the issues that we have found in Northern Ireland, and I congratulate the work of speech therapists, is recruitment, and maybe the honourable member will deal with that. What we find in Northern Ireland is we may have 15 young ladies, and it's predominantly young women that come into this, will start the course or go into the college, but within a year we're left with 4 or 5 trying to finish the course. So there is an issue there with the provision of therapists per se. They do a fantastic work, but maybe I'd be interested to hear the comments on the honourable member on that.
That's an interesting contribution, and just highlight a problem I think covers so many areas of medical training, that what comes in at the beginning doesn't always come out at the end. We have to support those who are making a commitment to public service. I think it's also worth pointing out, though, that speech and language therapists play an immensely important role across a wide range of areas. Take the youth justice system, for example. They are children too. We often forget that. We don't think of them as children. But the work that speech and language therapists do within young offender institutions is a vital component part of reducing reoffending rates, for example. And it's crucial for life chances. The Children's Communication Coalition made a very interesting comment in its June 2010 report, where it said, the true costs of not supporting children with speech, language and communication needs, above and beyond those that are measurable in direct financial terms, are very great indeed. The personal and familial costs of poor educational attainment, descent into criminality, and long-term exclusion from the mainstream are hugely significant and potentially corrosive to society at large. Poor educational outcomes often lead to poorly paid jobs or unemployment, and this can lead to a perpetuation of the poverty trap and a vicious cycle of health problems and health inequalities. In a sense, that could sum up the entire debate today in the space of 30 seconds, and I could just sit down and go away. But I do think it covers everything that we need to be concerned about. Yes, thank you.
Smith.
Along with the other two contributors, can I congratulate the honourable member on securing this debate today. As well as literacy and numeracy, does the honourable member believe that communication competency needs to be a key performance indicator in our schools?
I agree entirely, and you were just about to preempt my point, which is that speech and language therapists are not just there to help children. They are also there to help the entire children's workforce understand that communication has to be the golden thread running through everything they do. And they need to be equipped to train staff, teachers and others who work with children, as well as the children themselves. And I would ask the Minister to confirm that she will do all she can to ensure that we recruit more speech and language therapists that are needed to meet the unmet needs that are out there, and also that the Better Communication Action Plan made a specific commitment to universal screening as part of the Healthy Child programme. Many major bodies, including the Royal College, who has managed to get many supporters here today, I suspect, want to see it occur at both the ages of 2 and 5 in advance of the reading assessment. Can the Minister confirm what steps she will be taking to try to ensure that that aspect of the action plan is actually taken into account? I think another important aspect of this that we might often overlook is that often when we discuss children's speech therapy, we think of those aspects which are what I would call high incidence but low need. In other words, very many children do face forms of communication problems, language delay, for example, but their needs are actually quite low in terms of support. There is a much smaller group who have much more complex needs, but the incidence of that need is relatively low. And I think that poses a particular problem in commissioning. And I wonder what the Minister's views are on how we balance those two competing aspects. Because where you have low incidence but high need, it's often more of a health intervention that is required rather than an educational intervention. Certainly, yes.
Just this last year, I witnessed what I would currently describe as a transformation of a young boy from not being able to communicate within a matter of months to being able to talk quite clearly. And I've seen at first hand perhaps the work that can be done. One of the concerns that we have, I have to say, and that many people who look after young boys and who try to train them as well, is a financial provision. In the comprehensive spending review cuts that have been made and how they're going to affect, would the Honourable Member agree that this frontline service of speech and therapy should be retained, and that that people should know that the monies are there for the young people?
Thank the Honourable Gentleman for his intervention. I agree entirely. It's why we say continually that the most vulnerable are those that really should be protected, and frontline services will be protected. I think it's always easy that whenever we try to abolish quangos in particular, we can always find one saving grace in every quango that gives us a justification for saving it. And with BACSO, which provides educational technical equipment, one of their saving graces was the work they did in the augmentative and assisted communication sector, AAC for short, just to save me on a bit of time. Can the Minister confirm whether the funding that was originally going to go through BACSO towards the AAC sector, well, it will still take place to fund not just the specialist provision of AAC equipment, but also the leadership roles in that sector? Another part of the Better Communication Action Plan that I hope will be continued right through the year of speech, learning and communication in 2011. And will she also commit to re-examining the issues of provision in the AAC sector? She may not be aware of the problems facing the ACE Centre in Oxford at the moment, which is facing closure as a result of some of the changes within that particular charity and the funding of the wider sector. And finally on AAC, will she support the communication champion Jean Gross's proposals for a new commissioning model specifically around AAC, which reflect the differences between high incidence low need and low incidence high need, which I think are crucial to a proper appreciation of this sector's needs? I did say earlier I didn't want to go in for continually shocking statistics, but let me just give you one, which is that 55% of children in the more deprived areas arrive at primary school with some form of language delay. Now, that doesn't mean that there isn't anything going on. It just means that they are delayed in the formation of basic skills for a whole range of reasons, but often it can be something as simple as mum and dad not talking to them when they were babies. Book Trust, a charity many of you may be aware of, does fantastic work in more deprived areas just by handing out bags of books to young mums to encourage them to read, to say to young dads, actually, it's a good thing to sit down with your young child and read a story to them. Don't just watch the football match, actually read Peppa Pig or, whichever other children's literature you happen to have at hand. It's not an undone thing, and it actually helps your children. Can the Minister confirm, in the light of the CSR, that the very important funding Book Trust gets from the government that allows them to access £4 of private funding for every £1 of government funding will continue to help us close that language delay and that gap in the most deprived areas? It's just one example of the philosophy of early intervention that I think gradually is getting unanimous all-party support as a principle. What it often means in policy terms can often vary quite greatly, but the very principle of early intervention now seems to be accepted by all around this House, I hope. And it allows us to escape the departmental silo thinking that has so bedeviled public policy formation in this country for far too long. Can I ask the Minister how she thinks the pupil premium that both the coalition parties advocated pre-election will actually benefit children requiring speech and language therapy at the moment? And in particular, does the Minister agree on the importance of appropriate diagnosis, and that by improving the quality of diagnosis, it might actually lead to fewer people, or fewer children rather, being diagnosed as having special educational needs? And does she recognise that one goal of speech, language and communication therapy has to be to take pupils off the special educational needs register? Because their language delay has been closed, the gaps have been filled in, they're actually now able to participate fully in society. Because there is a particular problem with stigmatisation. Even in, 30 years ago now, when I had my speech therapy, I was taken out of my primary school, transported down to the village health centre. I was regarded as different, special because I had to be taken out. Now, that was 30 years ago. One would like to think that things had moved on. Unfortunately, the stigma is still there. And I would urge that more and more services can be delivered within the school setting and don't require the pupil to be stigmatised, made to look different or made to look special. And maybe just one way of doing that is what I know they do in my neighbouring constituency of Lancaster and Fleetwood, at Fleetwood High School, where children with special educational needs are dealt under the same umbrella as those as a gifted and talented scheme. And that isn't quite such a difference as you might think, because very many people with special educational needs, and in particular speech and language needs, are actually also very gifted and talented young men and women. And so the two are actually very often the same group. So I would urge you to look at how that can maybe reduce stigmatisation. I warmly welcome the ambition of the forthcoming Green Paper to equip parents to have more choice, more say over how their children are treated by the, quote, system. One of the grave frustrations of so many parents that I meet in my surgeries, and I'm sure everybody else meets in their surgeries, is the fact that parents take their children down to an office of whatever public organisation, and they sit down to have a discussion about what their children's needs are. And immediately, what they find is that there is a form in front of the public servant in front of them, and that they are then forced to somehow adjust their child's needs into the existing boxes on the form. That if their child doesn't quite fit into the forms on the page, then there's a problem. They don't quite get the tailored support they need. Can the Minister make any suggestions as to how we start to change that tick box culture? I think it is the most crucial question in public policy at the moment, which is how do we get away from a situation where services are designed for you to fit into, to a situation where services are designed that fit around the needs of the individual. I do think it's important. I give way to the Honourable Gentleman.
I'm grateful to my honourable friend for giving way, and I'd like to congratulate him on his contribution and in securing today's debate. But as he refers to the proposed to the Green Paper, does he express concern, or does he share my concern about the risk to the statementing procedures and the potential withdrawal of the rights that currently stand under the statementing procedure, in that, and as an example in terms of the importance of the statementing procedure to speech and language therapy, is that 10% of cases to the Special Educational Needs Tribunal are brought about as a result of deficiency in speech and language therapy provision in schools.
Paul Maynard.
I think that's a very important statistic, and I thank him for making that contribution, and I hope it will be borne in mind that we have to get the process of diagnosis right, that there is no point merely diagnosing children with special educational needs as a shortcut to fulfilling some sort of target in some back office somewhere. The system has to be designed around the needs of each individual child. Finally, you'll be all pleased to hear, I'm sure, and most importantly, my biggest concern about this entire Green Paper is the fact that so much of what we're going to require is going to have to come from the Department of Health as well as the Department for Education. And my big fear, based upon observing 20 years of public policy in this country, is that getting departments to talk to each other, to sing from the same hymn sheet, to work to the same agenda, is perhaps the hardest task in government. It isn't enough just to have the smiling, happy faces of two cabinet ministers at the bottom of the introduction page of a government document. That actually needs to be an alignment of strategic priorities, close working, close partnership working and agreement. Can the Minister confirm what joint working is occurring with the Department of Health and how their plans for NHS reform, academies and special educational needs are going to coalesce seamlessly? Because that is a real challenge. I don't want to go back into these statistics, but when so many of our children are struggling at school through no fault of their own, but merely because their needs have either not been identified or not catered for adequately, that to me, there are too many people, too many children who are trapped. It is a form of social exclusion that they are not able to participate fully in society. I strongly welcome all the Minister is doing on this field, and I urge her to continue her work. I look forward to seeing the Green Paper. I'm sure many others in the sector do. I look forward to hearing her answers to our questions today. Thank you very much.